The date is August 18. This is the news on PBCJ. I'm Gabrielle Thompson. The Health and Wellness Ministry has confirmed the presence of the highly contagious Delta variant of the coronavirus COVID-19 in Jamaica. In a release, Portfolio Minister Dr. Christopher Tufton said, quote, "We have received 40 results from the 60 samples sent to the Caribbean Public Health Agency. 22 are positive for the Delta variant," end quote. The confirmation of the presence of the Delta variant comes as Jamaica recorded 289 new COVID-19 infections and confirmed 19 deaths in the last 24 hours. The total number of infections now moves to 59,377 since the first case was confirmed last year, while the total number of deaths stands at 1,339. The Jamaica Public Service Company, JPS, says teams are still assessing some of the damage to the power delivery network. Director of Corporate Communications at JPS, Winsome Callum, says the rains associated with Tropical Storm Grace caused the power outages, which have been reported in all parishes, but northeastern parishes are the worst affected. Ms. Callum is asking customers to be patient, as it will take some time to get the power back on, especially in communities where the infrastructure is badly damaged. Customers can report outages using the JPS app or website. The National Water Commission, NWC, is also reporting hiccups in supply systems due to rainfall associated with Tropical Storm Grace. Corporate Public Relations Manager at NWC, Andrew Cannon, says several areas are now without water. Mr. Cannon listed St. James and Westmoreland as parishes affected by turbidity, while sections of St. Andrew, including August Town and Mona Heights, are experiencing low or no water. He is asking for customers to be patient. Tropical Storm Grace carved a path of destruction across the island on Tuesday, August 17. In Kingston, it downed trees, knocked out power to some communities, and caused damage to homes, businesses, and widespread flooding, including the Hope Zoo in Kingston. A huge tree came down close to the Apex Medical Center, making Malines Road in Kingston impossible to vehicular traffic. Early Wednesday morning, a cleanup crew, including a team from the Jamaica Public Service, worked tirelessly to get Malines Road opened to vehicular traffic during the morning rush hour.
For about after 1 yesterday, and see there, this is now almost 7 o'clock and it has been cleared. NSAA is right around the corner, no trucks, nobody. They just start working on it just now. It's a shame and it's a disgrace. What happened if there are several trees? When next week will it clear?
Citizens are urged to report tree storm damage to relevant authorities for removal. If power lines are involved, residents are urged to call the JPS emergency number at 1-888-225-5577. Jamaica will prioritize the vaccination of children 12 years and older following the arrival of the Pfizer vaccine later this week. The island is this Thursday to see the first batch of a total shipment of 608,000 doses of the vaccine to arrive in the coming weeks, the result of negotiations through the Health and Wellness Ministry and the Foreign Affairs and Foreign Trade Ministry with the government of the United States of America. The donation will be delivered in 3 shipments over 3 months. The first batch will comprise 204,000 doses. In a release, Health and Wellness Minister Dr. Christopher Tufton said, quote, "The prioritization of children is critical at this juncture. This is in the context of the suspected presence of the Delta variant in the island and its increased adverse impact on younger persons," end quote. As part of the government's mandate to prioritize education and the reopening of schools for face-to-face instruction, the Health and Wellness Ministry will finalize discussions with the Education, Youth and Information Ministry on the ways in which students 12 years and older can be facilitated for early vaccination. The island is also shortly to receive a shipment of the Johnson & Johnson vaccine. The Health and Wellness Ministry is also advising pregnant and breastfeeding mothers to get vaccinated against COVID-19. This is in line with recommendations from the World Health Organization and having regard to evidence which suggests that pregnant women with COVID-19 are at a higher risk of developing severe illness compared to non-pregnant women of reproductive age. COVID-19 in pregnancy has also been associated with an increased risk of preterm birth and of newborns requiring neonatal intensive care. Pregnant women who are 35 years and older or have high body mass index or an existing comorbidity such as diabetes or hypertension are at particular risk of serious outcomes from COVID-19. Pregnant women who are vaccinated against COVID-19, as other members of the population, can experience common side effects. Those side effects, which are mild and temporary, include swelling, tenderness and pain at the injection site, fatigue, chills, fever, headache, and nausea. To become vaccinated, members of the public are encouraged to make their appointments online at www.moh.gov.jm or call the Vaccination Call Center at 888-1-LOVE. That's 888-663-5683. Almost 100 persons have tested positive for COVID-19 at the Hinduja Global Solutions Jamaica HGS. One employee has reportedly died due to complications from the virus. Anand Biradar, Senior Vice President and Country Head of HGS, says safety protocols were put in place to avoid such an incident. It's understood that about 94 people were tested positive for COVID-19 out of a staff of 750 persons. The company is cranking up its campaign to vaccinate reluctant workers following the passing of the firm's communication manager, Marvel Gordon, on Friday. Public health facilities are under stress from the daily intake of coronavirus COVID-19 patients. That's the word from the Ministry of Health and Wellness. Speaking at a recent press brief, Chief Medical Officer CMO Dr. Jacqueline Bisesa McKenzie said that bed occupancy is over 600 cases and daily admissions are now about 70 persons.
We're seeing in terms of bed occupancy, our hospitals are under extremely high pressure as we very, very quickly are approaching our capacity for COVID management, and therefore that will spill over into our general occupancy. In terms of positivity, we have jumped. We're over 30% at a very high transmission level in country. Our reproductive rate remains at about 1.3, which means that as the numbers go up, more and more persons are being exposed and becoming infected.
Time now to get an update on the various financial markets and a quick word on the reopening of tax offices island-wide. We go to the business report. The Tax Administration Jamaica TAJ is advising customers and staff that following early assessment, some tax offices are to remain closed or have delayed opening in the aftermath of Tropical Storm Grace. Tax offices located in the parishes of Portland and St. Mary, as well as the Crossroads Tax Office, will remain closed to the public. Reopening of all other tax and business offices have been delayed to 9 a.m. The tax authority says the scheduled reopening time of 9 a.m. could be further delayed at specific offices if conditions warrant it. TAJ says it is urging members of the public to continue monitoring the media for reports of road conditions, as some roads may be impassable due to flooding, fallen trees, downed utility poles, or landslides. Further updates will be provided with respect to the reopening of offices for regular operations. For additional information, you may call the Tax Administration Customer Care Center at 888-TAX-HELP. That's 888-829-4357, or visit the website www.jamaicatax.gov.jm. In Tuesday's trading session, the JSE Combined Index declined by 234 points to close at over 418,000 units. Overall market activity resulted from trading in 89 stocks, of which 33 advanced, 37 declined, and 19 traded firm. The Junior Market Index advanced by 47 points to close at over 3,000 units. Stocks advanced for Barita Investments Limited, Caribbean Flavors and Fragrances Limited, and Siboney Group Limited. Stocks declined for 138 Student Living Jamaica, AMG Packaging and Paper Company Limited, and Blue Par Group Limited. Trading firm were 1834 Investments Limited, Berger Paints Jamaica Limited, and Caribbean Assurance Brokers Limited. Supreme Ventures Limited was the volume leader with over 74 million units, followed by Mailpack Group Limited with over 1.4 million units and Deramon Trading Company Limited with over 1.7 million units. In foreign exchange trading for Tuesday, August 10, the US dollar sold for an average $154.89. The Canadian dollar ended trading at $123.56. The pound sterling traded for $212.82, and the euro sold for an average $182.64. In market data for oil, prices dipped on Wednesday, a fifth day of declines, with investors wary about prospects for stronger fuel demand as the use of rail, air, and other forms of transport remained constrained amid surging COVID-19 cases worldwide. Brent crude futures dropped 5 cents to $69.98 a barrel. West Texas Intermediate crude lost 6 cents to $66.53 a barrel. In today's Living Healthy, Dr. Heather Dawn Lawson-Myers addresses the issue of pregnancy and the effects it can have on a mother's dental health.
I just love waterfalls. They symbolize a continuum of water that is fresh and new at every second that you're watching it. It reminds me of new birth. Pregnancy is a wonderful time in a woman's life, but it's also the time when she really has to take good care of her body. And one of the easiest, simplest, most efficient ways to do that is to have good oral care. If the pregnancy is planned, it's a very good idea to have a complete dental check and have all the decay restored, have all the gum disease treated before pregnancy. Because her immune system, that thing in her body that fights infection, is going to be fighting for two. So you need it to be as strong as it possibly can be. Soft deposits develop on our teeth every day, regardless of whether we eat or not. And if we're not able to adequately remove those deposits, they're a source of infection and inflammation. Simply brushing and flossing effectively on a daily basis goes a long way in keeping a mother healthy as she prepares for her child. However, many times that's not the case. And that accumulation of plaque, that soft buildup, can lead to tooth decay, and it can cause inflammation of the gums. Inflamed tissue bleeds. So bleeding is an indication that the gums are not so healthy. In the later stage, it can affect the bone support under the gums, and that is an irreversible situation. The bone that is eaten away will never grow back. In some mothers, it's not just that the gums get inflamed, but they may develop pregnancy tumors, just little boils that develop on the gums, and they never go away during pregnancy. After pregnancy, sometimes they go away, but sometimes they'll have to be surgically removed by a dental professional. Inflamed gums and bone that is eaten away are signs or conditions of periodontal disease. Periodontal disease also affects the mother and her child beyond the mouth. Inflammation traveling through the bloodstream can affect the baby. Inflammation can cause a problem, but also there's a condition known as preeclampsia, in which the mother's blood pressure is elevated to the point that it's unhealthy for her and the baby. Either of those scenarios can lead to low birth weight babies because the babies are born before they come to term. Those babies that are always at a higher risk than babies who are brought to term. In general, it is best to avoid doing any kind of routine dental work in the first 3 months or the first trimester, or the last 3 months, the final trimester. The safest place is in the middle term. Dental cleanings can be done anytime throughout the pregnancy. And of course, an emergency will have to be addressed at the time of need. But it's safe to say routine dental work should be done in the middle trimester. Pregnancy is truly a modern-day miracle, but there are some very simple yet important things that a mom can do to ensure that she and her baby are well protected. One of the simplest ways to do that is to practice good oral hygiene. Listen, catch us the next time on Facebook, YouTube, and Instagram. See you next time on HD's Jazz.
In regional news, heavy rains accompanied by gusty winds in South Trinidad tore the roofs off of several homes on Monday afternoon. The Disaster Management Unit DMU of the Ministry of Local Government reported that 6 houses were affected in Los Iros. Less than 24 hours later in Palo Seco on Tuesday morning, disaster struck again. Karen Cozier-Phillip has more in this report.
Residents of R.E. Road in Losiro are picking up the pieces after Monday's freak storm, which they described as a tornado.
Yeah, well, we just see a piece of that cloud coming, and after that we just see this line of black thing and the breeze that blow, and just all these houses and them, the roof just gone, and galvanized just started flying. The galvanized went about 300 feet up in the air and dropped in the sea.
Another resident says he was outside washing when it began to rain, and in a flash his roof was gone.
I wouldn't like anybody to experience what happened yesterday. I thought you only see that in movies, but yesterday it was a reality.
A team from the National Commission for Self-Help, the Member of Parliament for Labray, Stephen McClatchy, and the local government councillor for Palo Seco visited the area on Tuesday morning to examine the extent of the damage.
So we have persons would have lost their televisions, residents said his laptop, furniture, beds would have been soaked, school supplies.
And just as the damage in Losiro was being assessed, came reports of roofs being blown off at number 9 Road in Palo Seco. Maxine Lal Chan was at work and got a phone call that disaster had struck at her home.
I don't know if I could be able to use the stove, because the stove on top it would fill with water. My couch, everything, all that soak. Well, I didn't check the TV and things. Well, when I home, I go check that. Because
the CEO of the Commission for Self-Help, Elroy Julian, says residents affected by the freak storm will receive assistance through the Commission's Repair and Reconstructive Grant up to a maximum of $25,000. Karen Cozier-Phillip, TTT News.
As many Caribbean countries continue to grapple with COVID-19 infections and deaths, the uptake of the life-saving COVID-19 vaccines in the region remains unacceptably low. This according to Chairman of the Caribbean Community CARICOM and Prime Minister of Antigua and Barbuda Gaston Browne. He was speaking at the virtual installation ceremony of the 8th Secretary General of CARICOM, Dr. Carla Bennett, on Monday.
Navigating the COVID-19 pandemic has been a focus of the Chairman of the Caribbean Community, CARICOM, and Prime Minister of Antigua and Barbuda, Gaston Browne, and his predecessor, Prime Minister of Trinidad and Tobago, Dr. Keith Rowley. This is so because the pandemic had disproportionately affected the Caribbean region, devastating especially the tourism-dependent economies with the introduction of lockdowns and travel restrictions. Prime Minister Rowley had been a fervent advocate for a more equitable distribution of the COVID-19 vaccines instead of hoarding by the world's larger economies. But on Monday, during the virtual installation ceremony of the new Secretary General of CARICOM, Dr. Carla Bennett, Prime Minister Browne said that the vaccine hesitancy was becoming a considerable issue in the Caribbean.
In the region, we have to tackle the twin contradictory issues of access to vaccines as well as vaccine hesitancy among our populations. And we must not be daunted by these challenges. We are compelled to triumph over this murderous pandemic. In many of our member states, the percentage of our population that has been fully vaccinated is still unacceptably low. And there is great risk that we will not reach herd immunity in very many months. We need to correct this, and we have to continue to stand together to fight the issue of vaccine hesitancy, which is perhaps the most significant threat to the region at this time.
Over the past few weeks, donations of vaccines to the Caribbean region were announced by the United States. Some countries have been able to benefit from further supplies from the international COVAX facility, while other countries have been able to procure vaccines on their own as well. The Pan American Health Organization, PAHO, as of Tuesday, reported that nearly 3 million vaccine doses have been distributed across the Caribbean region, excluding Latin Caribbean countries. But there have been some anti-vaccination sentiments. In St. Vincent and the Grenadines, Prime Minister Ralph Gonsalves was struck with a rock, reportedly by an anti-vaccination protester. In Antigua and Barbuda and Guyana, there were some protests over the introduction of vaccination requirements. Providing brief remarks at her installation ceremony, Dr. Barnett said that she is assuming the position acutely aware of the challenges the community faces at this time.
Chair, I begin my tenure with no misapprehensions about the severity of the challenges that our community faces economically, socially, environmentally, and financially. The thrust to build resilience against the existential threat of climate change in all its dimensions, and the urgency of constructing a recovery from the adverse effects of the COVID-19 pandemic demand our continued focused energy. Even as we address these critical tasks, we cannot afford to neglect youth unemployment, which has led the explosion of the jobless in the wake of COVID-19. A troubling rise in crime, especially violent crime in the home and on the streets, the need to strengthen food security, reduce the incidence of non-communicable diseases, and more effectively address the issue of blacklisting by the major industrial countries and the consequential loss of correspondent banking relations. All of these affect the lives and livelihoods of each and everyone in our community.
The chairman of CARICOM and the new Secretary General will work with the heads of government of CARICOM to bring relief to the region. Reporting for the newsroom, I am Vashani Raghbir.
The World Health Organization's Director General says urgent medical aid is needed in Haiti following last weekend's devastating earthquake. At this time, the death toll from the quake stands at 1,941. The Director General's comments were made during a media briefing on Wednesday.
In Haiti, so far we know that the earthquake has killed more than 1,900 people, left thousands more injured and homeless, and impacted more than 2 million people. To compound the situation, Tropical Storm Grace caused heavy rain and flooding to the country. Our colleagues at PAHO have helped send emergency medical teams and supplies. They have also been on the ground supporting the authorities with an assessment of the damage to health facilities. 4 have been destroyed and a further 20 damaged. Urgent needs include medical personnel, health tools, and logistical support for the delivery of supplies, deployment of people, and transfer of patients. We're continuing to support the government and people of Haiti by all means possible during this difficult moment.
In St. Lucia, the Prime Minister's office will have oversight for the police. Deputy to the Governor General Errol Charles made this revelation on Tuesday during the delivery of the throne speech heralding the official start of the first session of the 12th Parliament. More in this report.
The St. Lucia Labour Party administration plans to appoint a special prosecutor to investigate allegations of corruption among politicians and government officials. So says Deputy to the Governor General, His Excellency Errol Charles. His Excellency Charles unveiled the policies and the legislative agenda of the Philip J. Pierre administration in the traditional throne speech at the opening of the new parliamentary session on Tuesday.
My government, in recognition of the widespread, unprecedented reports of alleged corruption during the term of the last administration, will appoint a special prosecutor to investigate allegations of corruption in government. This appointment is expected to be completed soon. My government will strengthen the Integrity Commission to return our country to a system that respects our democratic norms and the rights of the people, my government will reactivate the bipartisan parliamentary committee to review Justice Susie Doven's Constitution report and the parliamentary recommendations with a view to adopting final recommendations for implementation. Strengthen the Integrity Commission so that it can undertake the more meaningful action against public officials and the politicians who engage in acts of corruption.
The peer government seeks to give the national security apparatus, including the principal law enforcement agencies, more operational autonomy.
In my Prime Minister's configuration of ministries, the absence of a minister for national security. Given the highly important role of the police, the Prime Minister's office will be the oversight authority for police. My government's intention is to provide greater operational independence to our police service and the police commission of police. The police should be allowed to do their work without being encumbered by political decision politicians. In addition to providing the police with the necessary resources to be effective in their work, my government will address the underlying social structures which give rise to crime and deviant behavior.
Amid concerns about outsized executive overreach during the previous dispensation, the Deputy to the Governor General also indicated that the new SLP administration's main legislative agenda will be subordinate to and driven by legislative branch parliament.
My government intends to uphold the Constitution of St. Lucia in both words and deeds. And so, out of respect for the people and the Constitution of St. Lucia, which seeks to provide order and good governance in the management of our country's affairs, the intended structures of Parliament will be observed. Provision has therefore been made to ensure that the position of a Deputy Speaker for the House of Assembly is occupied.
The St. Lucia Labour Party administration also plans to review the deals and development agreements hashed out during the last administration and only continue projects which are considered viable. The HIA redevelopment and controversial Desert Star Holdings project will be up for intense scrutiny. The SLP government expressed resolve to keep its promise on paying school facility fees. The Deputy to the Governor General disclosed that the PIA administration is in the throes of processing the payments for the new school term. It will also meet the cost for the CXC subjects of mathematics and English. Joachim de Plessis, HDS News Force.
In sports, we go to athletics. The World Under-20 Championships in Nairobi, Kenya gets underway today, Wednesday, August 18, 2021. In a continuation of our Meet the Athletes series, our reporter Marlon Samuels puts the spotlight on Aaliyah Francis.
My name is Aaliyah Francis. I'm from Rossies High. I'll be doing the 200 meter and the 4x400.
Aaliyah Francis showed her dominance in the Class 1 200 and 400 meters by winning the double at the Girls' Championship in May 2021.
I'm hoping medal, first place medal, and hopefully a personal best.
She hopes to stamp her dominance in the 200 meters and as part of Jamaica's 4x400 meters relay at the World Under-20 Championships in Nairobi, Kenya.
I'm hoping medal, first place medal, and hopefully a personal best.
For the news on PBCJ, I am Marlon Samuels.
And that's our package. Thanks as always for watching the news on PBCJ, the People's Station.